Welcome to this edition of the First Aid Show. In our first responder training, some students find it hard to adapt from working as an alone first aider to working as part of a team as a first responder. We asked a paramedic, how can you work effectively as a team in an emergency?
Within the medical world and within the emergency services in the ambulance and also the critical care teams that come from the air ambulance, you will see us working in teams of two. And it is really common that we will be working on a shift with somebody that we haven't worked with before. But we do train that as we approach the scene, as we approach the casualty, that we assign roles. And you may have the perception that one role is more important than the other, but actually you need both of those roles to be effective in order to deliver excellent care. If you arrived on scene and somebody needs immediate first aid, one of you needs to verbalise, I'll look after the patient, and the other person can open the kit, access the oxygen or bandages, get the history from a bystander or a family member. All of the information you gather is important to the care of that casualty. So don't think just because you get the job of looking and talking to the relative that it's not important. You might find out something that's so critical that changes the speed that we're able to give treatment to that casualty and improve their chances of survival. So talk and be prepared that ideally, one of you needs to be a leader and one of you needs to be a follower, and just delegate and decide which role you're going to take and then just get on with it and work together. If in the middle of a situation it's not working particularly smoothly, vocalise what you're seeing, what's happening, and be prepared to swap roles if that's going to benefit the patient or if one of you's frozen or struggling. You know, it's a dynamic situation and we all behave and react differently. We can't always predict how we're going to react to a scenario. Some of us may have seen that situation before and feel a little bit more confident and comfortable with providing the care that's needed. Sometimes within a team, people will naturally assume that the older person or the person with more experience, or maybe somebody that has a different professional capacity would take the role as the leader. That doesn't have to be the case. As long as you verbalise who's doing what job and allocate jobs, then both of you are contributing equally to the care of the patient.